Hello everybody, and welcome to this lecture from CyberMD. This lecture will cover the large vessel vasculitides. Please be sure to like, comment, and subscribe to our content so that we can continue to provide free medical education resources to students around the world. Let's get started. Today, we will be discussing two types of vasculitis that affect the large blood vessels of the body. First, however, let's talk about the layers of the blood vessel wall as a quick hit on vascular anatomy to prime us for the lecture. Remember that the innermost layer of the vasculature is called the intima. Specifically, we're talking about arterial vasculature here. And remember that the intima is made up of epithelial cells that are on top of a basement membrane. And then you move into the middle layer of the vessel wall, known as the media, and that's composed of smooth muscle cells. And then you arrive at the outermost layer of the vessel wall, which is the adventitia, and that's made up of connective tissue. Disruption of the intima, those epithelial cells, can lead to thrombosis or the formation of blood clots due to exposure of the subendothelial collagen, which can obstruct blood flow and lead to tissue ischemia or oxygen deprivation distal to the site of that obstruction. Additionally, chronic inflammation of the cells composing the vasculature may result in fibrosis, which may also lead to ischemia as the lumen of the vasculature narrows. The first of the large cell vasculitides that we will cover is Takayasu Arteritis. This is a granulomatous vasculitis that usually involves the aortic arch at the aortic arch branch points. It typically presents in adults younger than 50 years old, especially young Asian females. Takayasu arteritis may cause visual and neurologic symptoms and may be accompanied by a weak or absent pulse in the upper extremities, also known as pulseless disease. Patients may also experience a disparity in blood pressure between the arms, left and right. You may find that they have a bruit over the subclavian artery or the abdominal aorta. They may experience syncope, and they may experience chest pain. You may find an elevated ESR whenever you go to do lab work on these patients, and you may also see an elevated CRP. Now, just previously, I had said that you may see a weak or absent pulse in the upper extremities. And remember to think about this a little bit. If you see that this patient has weak or absent pulses in their upper extremities, that means something's obstructing the flow to their upper extremities. And both of your arms, your upper extremities, the arterial supply to those arms comes off of the first branch points of the aorta. So if you have any kind of fibrosis or inflammatory process that's closing the lumen of those arteries, you're going to have weak or absent pulses distal to that, which is in your upper extremities. MR angiography is the preferred diagnostic study for Takayasu arteritis, and it may reveal vascular wall thickening with luminal stenosis or occlusion of the aorta and the major branches. Angiography may also show stenosis of the aortic arch and the proximal great vessels. Biopsy may confirm the presence of granulomatous inflammation of the aorta and its major branches. So remember, we were just talking about having inflammation and fibrosis narrowing the lumen. Right here, you can see on this angiography scan right here that you are having this kind of fibrosis distorting the normal vasculature, especially over here. You can see how it becomes stenotic. The lumen narrows right here where my laser pointer is at. And you can see how that would lead to like the pulseless disease that we were previously talking about. Moving on, corticosteroids are the primary treatment for Takayasu arteritis. In addition, a glucocorticoid sparing agent, such as like a methotrexate, infliximab, or like an azathioprine, may also be used. And that combination is necessary to prevent side effects of the corticosteroids, which are helping to prevent disease progression. Okay, we're going to keep moving on into the second type of large vessel vasculitis, which is temporal arteritis or giant cell arteritis. And this is a granulomatous vasculitis that commonly affects branches of the carotid artery. It's most common. It is the most common form of vasculitis in older adults, especially in women who are over the age of 50 years old. Patients with temporal arteritis often present with symptoms such as headache, visual disturbances, and jaw claudication. They may also experience flu-like symptoms, joint and muscle pain as well, as the condition is actually associated with polymyalgia rheumatica. You may see an elevated ESR in these patients as well whenever you get lab work. A biopsy of the inflamed vessel wall with giant cells and intimal fibrosis is needed for a definitive diagnosis of temporal arteritis. This biopsy must be taken from a long segment of the vessel, as lesions are segmental as opposed to being continuous. Because the lesions are segmental, a negative biopsy technically does not exclude diagnosis of the disease. So you can imagine how if the lesions are segmental, if you don't take a long enough piece of the vessel for biopsy and you don't have a segment in that biopsy that has any kind of fibrosis or lesions, you can see how this would be, you would think that this was a negative diagnosis when in fact the patient still does have the disease. Without treatment, temporal arteritis can cause visual impairment and even blindness. And the reason for this is that the ophthalmic artery is a derivative of the internal carotid artery, and therefore it may be affected by the disease. In order to prevent that from happening, high-dose corticosteroids are administered to avoid any permanent vision loss. Duplex sonography may reveal a halo sign around the vessel, but the gold standard is still a temporal artery biopsy to confirm the diagnosis. In conclusion, both temporal arteritis and Takayasu arteritis are severe conditions that require early diagnosis and treatment with high-dose corticosteroids to prevent permanent vision loss and other associated complications. We hope this lecture helps, and again, please be sure to like, comment, and subscribe so that we can continue to grow this platform and provide free resources to medical students to further along their medical education. Thank you.